Hello and welcome back to Patient Knowledge. I'm Dr. Kirmani. Now, how many of you know that if you pee more than 8 times in 24 hours, it's more than usual? And you must be wondering, why do we pee more often? So let's get started and see more about it. And today I'm going to be telling you in detail about some of the causes of excessive urination and its remedies. Anxiety. That's the most common cause. Now, many people feel like going to the toilet before embarking on a long journey, before starting for work, or while waiting outside to be called for an interview. And many students taking up examinations rush to the loo before entering the examination hall. Now, this is all because of anxiety. Infection in the urinary system can be another cause of peeing more often. Our urinary system consists of a pair of kidneys that are connected to a pair of tubes called ureters that carry urine into the bladder. Now, the bladder opens into a short passage called urethra. The urine comes out through the urethra. Due to the close proximity of urethra and vagina, the organisms can infect the bladder. And this is called cystitis, which is a painful bladder infection and very common in women. This infection can travel up to the kidneys. Now, if you are experiencing any of these symptoms, it's time to see your doctor. Your doctor will do a test and will do a urine test and will confirm the urinary tract infection and will start a course of antibiotics that has to be taken for 2 weeks. It's crucial to treat the urinary tract infection because if it's left untreated, it can lead to complications where the infection can travel up to the kidneys and can damage the kidneys. Diabetes. People with diabetes, while eating too much sugar, this can cause them to urinate more frequently. And this is because it can cause a spike in the blood sugar level. Now, there are some other symptoms of hyperglycemia or a spike in the blood sugar level. These are increased thirst and increased hunger, along with a delay in wound healing of any skin infections. Now, if you're a diabetic and you are experiencing any of these symptoms, check your blood sugar level. And if it's high, take the medicines to bring it down to normal. Stress incontinence can be another cause of going to the toilet more often. This is experienced by women who have had a childbirth recently. Sneezing, laughing, or coughing can cause leakage, which can be experienced in women soon after childbirth. This is due to weakness of the pelvic floor muscles or damage to the birth canal during childbirth. Now, if you are a woman in the age group of 45 to 55 years and having trouble with your waterworks, such as frequent peeing or leakage, it's a sign that you are nearing menopause. Now, you must be wondering, what does it have to do with waterworks? Now, during menopause, the levels of female hormone estrogen begins to fall, and this can lead to weakness of the pelvic floor muscles. These muscles support the bladder and keep it in position. Due to weakness of these muscles, the bladder issues arise, and this can be fixed easily by Kegel exercises, which help to strengthen these muscles. Men in the age group of 45 to 55 years develop urinary problems, and most of them complain about peeing more frequently, hesitancy of urine, weak stream, and incomplete emptying of the bladder. These are caused because of outlet obstruction. It's because of enlargement of the prostate gland, and this condition is called as benign prostate hypertrophy. Prostate is a brownish gland about the size of the walnut located at the neck of the bladder. The enlargement of this gland causes pressure on the urethra and leads to outflow obstruction. Now, if you are a man in this age group and experiencing any of the above symptoms, it's time to see your doctor. Now, what will a doctor do? Well, they will perform a digital rectal examination and a blood test called PSA or prostate specific antigen. Combined results of the two, if it is confirmed that this is related to your enlargement of prostate gland, the doctor may decide to do a surgery called as prostatectomy, where they're going to remove the prostate gland and relieve the symptoms. Bladder stones can be another reason why people need to urinate more frequently. Now, stones in the bladder can cause pressure on the bladder, and this results in frequency. And this could be the only symptom of bladder stones. Now, the bladder stones can be detected by an X-ray or an IVP or intravenous pyelography. This is a special type of test where a dye is injected through your vein and a series of X-rays are taken. This not only tells the location of the stones, but also tells us about the size and number of stones present. Now, if the stones are confirmed, they can be removed by a surgery. Certain medications can also cause excessive peeing. These are called diuretics or fluid tablets, which are given for the treatment of high blood pressure and people who have congestive heart failure. These tablets will help to flush out the excess fluid buildup in the body. We all know that all our organs are supplied by nerves, and so is the bladder. And if there is any involvement of the nerve, it can lead to bladder problems. These are called neurogenic causes and can be seen in conditions such as Parkinson's disease, multiple sclerosis, or in people who are recovering after stroke. Excessive intake of beverages such as alcohol, caffeine, and water can definitely lead to increased urination. Now, the remedy would be to reduce the intake of these beverages. Here are some home remedies which might be useful in managing the urinary problems. Manage fluid intake. Avoid taking any fluids 3 hours before going to bed. This is especially useful for people who have to wake up at night to go to the toilet. Kegel exercises are useful for women who have problems due to childbirth and those who are nearing menopause. These are aimed to strengthen the pelvic floor muscles, where you need to tighten them and hold them for 5 seconds and repeat them for 10 times in a day. Maintain a healthy weight. You might not think that your weight affects your bladder, but it does. Extra weight can put pressure on your bladder and lead to frequent need to urinate. Healthy diet and exercise will help to maintain an ideal body weight. Cut back on caffeine because caffeine can irritate the bladder. Take vitamin D and avoid holding on pee for long, because holding too long can lead to stretching of the bladder wall, and this can cause more accumulation of urine in the bladder, which can lead to infection in the bladder. That's all for today. I hope this information was useful in understanding some of the common causes of excessive peeing and how to manage it. Thank you for listening. If you wish to see more of such kind of health related videos, support my channel by liking, sharing and subscribing it. Bye for now.